Good afternoon. I'm going to call to order this meeting of the Health, Environment, Civil Rights, and Engagement Committee for Monday, January 29th, 2018. My name is Philippe Cunningham, and I am the chair of this committee. With me at the dais are council members Cano, Schrader, Gordon, Johnson, and Jenkins. Let the record reflect that we have a quorum. Before we dive into the agenda, we have two agenda items, but before we get started, I just wanted to share that we have, we have a very long name in our committee, but no matter what the name is, most folks say it's the health committee, right? That's typically the most common language. And what I have learned already being the chair of this committee is that that language is actually very misleading because it makes folks think that we have jurisdiction over the healthcare system. That's what I've learned thus far. And so based on that, I wanted to share that I would like to actually propose just informally, the formal name to stay the same, but informally to actually call it the Public Health, Environment, Engagement, and Civil Rights Committee, or PEACE for short, with the formal name staying the same. The reason why I'm recommending for us to be inclusive of the public health is because that actually more accurately captures what our jurisdiction is, what the health department is doing, and it helps increase public accountability because folks have a better understanding of the jurisdiction of our work. And also, peace is easier to say than hecker. So there we go. So with that, so I just wanted to have that clarification. We'll have the formal name and then the informal name so that we make sure that we're communicating to folks actually more accurately what our work is. So with that, we have two items on the agenda today. One is consent and one is discussion item. The consent item is accepting a grant from the Public Health Institute to address health and climate change in Minneapolis. So it looks like one, accepting an additional grant from the Public Health Institute in the amount of $10,000 for a new not to exceed grant total of $50,000 and extending the termination date to June 30th, 2018 to address public health and climate change in Minneapolis. Two, authorizing amendment number 2 to agreement number 40203 with the Public Health Institute for the additional grants. And 3, passage of a resolution approving appropriations of funds to the health department. Do committee members have any questions? All right. Seeing no questions, I move approval of the consent agenda item. All those in favor of the motion, please say aye. Aye. Those opposed say no. The ayes have it, and that item is approved. Next, we have our discussion item, which is accepting a grant from the Minnesota the Department of Health in the amount of $156,000 for decreasing risk factors and increasing protective factors associated with Minneapolis youth and teen sexual health, and then as well as the passage of a resolution approving the appropriations of these funds to the Minneapolis Health Department. And today we have Barb Kyle, the Health Department school-based clinic manager, with us, who will be providing us with a short presentation.
Great. Good afternoon. Thank you so much, Chair Cunningham, for inviting me to share a few moments. I want to just let you know a little bit about the school-based clinic. And I know that we're on the agenda in the future to come back and give a more detailed presentation. Again, my name is Barbara Kyle, and I'm the manager of the school-based clinics in the Minneapolis Health Department. So you can see on the map where our clinics are located. Our clinics have been in existence since the late 1980s. We're located within the Minneapolis public high schools, and the high schools are listed. We're in all of the big high schools except North High, which has been always operated by North Point. And we also have one alternative school-based clinic for parenting students, Longfellow. Last year, we had about 12,000 visits in our school-based clinics, and we served over 2,000, nearly 3,000 young people, ages 9th grade, 14 through 18 primarily. I made a brochure of our program available. It's very colorful. We have our doors painted like that at the clinics. And so I do welcome you if you're interested and your jurisdiction is one of our areas or not, we'd love to have you come visit one of our clinics. Um, then I just wanted to talk a little bit about this grant. We are hoping to accept this PrEP grant from the Minnesota State Health Department. And it is work that we are continuing to do. For the past 8 years, the health department has successfully implemented the Safer Sex grant, and that was with federal funding through Hennepin County. And that funding is going away as that Office of Adolescent Health is being eliminated. So this comes at a very good time to get these dollars. The school-based clinic provides medical care, health education care, and mental health services. And this grant goes to our health educators to do one-to-one sessions with clients, looking at ways using motivational interviewing for them to come up with skills and ideas of how to change their behaviors and be safer and more knowledgeable. We found this is a different approach, and it has worked really well in the last 8 years. It's an evidence-based curriculum that we're replicating based on different research models, and we're really targeting the most needy kids for pregnancy prevention and also STI prevention. Initially, the grant is for 2 years, and hopefully it will be extended another year. So we've had a lot of efforts in Minneapolis the last few years to decrease teen pregnancy. And so I just wanted to take a minute, if I could, to share with you a report card that our research department recently put together on the births to teen mothers in Minneapolis. And it kind of gives you a sense of why it's really important that we continue to do work to prevent unplanned pregnancies.
I'm sorry, Barb.
Yeah.
Can we pause real quick? We have
Sure.
actually a question. I apologize. Can we go back a couple slides? He's got a
Yes,
question here.
thank you, Mr. Chair. My question is actually on the first slide on the schools. I didn't see Wellstone International on there. Is there a reason for that?
Pardon me? I didn't
Is
hear what you
Wellstone International High School?
Very good
is
question,
there
Councilmember Johnson. Wellstone was embedded at Roosevelt, and 2 years ago, the school moved to the Wilder Complex, which is in a neighboring building with a few other early childhood and a Transition Plus program. And being a small school of about 300 students, we couldn't leave our staff at Roosevelt serving 1,500 students to go there. So we've been working with the People Center to open a small clinic to serve students at Wellstone, and also hopefully the Welcome Center and T Plus and some of the other programs. So we weren't able to continue to see Wellstone as they moved off-site. We were able to transition. Some of the students would come back and continue some care until they were able to get things moving at the Wilder Complex.
I see Coral would like to add something, please.
Councilmember Chair, and just to add on to that, we do have a program at Wellstone. It's a teen pregnancy prevention program that we contract with Planned Parenthood, and provide funding to them to provide that program at that site.
Sure.
So I think that might be what you're referring to.
Well, and I'm wondering about the
With the
school-based clinic services. It sounds like there's a plan to open a small clinic working with People Center.
Yes.
When is that expected to open?
It opened last May, and very part-time, like one partial day, and I'm thinking they're hoping to expand. So they are officially going through approvals to become a school-based clinic located in that facility.
And how, with being partial day that they're open, how does that compare to the service provided at the other schools? Are those 5 days a week?
Yes. So our clinics are open primarily most school days, which is 5 days a week. We usually have 4 days of medical care from our nurse practitioners or physician assistants, and then some days of mental health. So none of our services are 5 days a week. They vary on the number of students in the building, and the need of the students. So we're usually about 4 days a week, different service providers at the clinics.
And so you mentioned that this small clinic will be expanding. Is that going to expand to be similar levels of service compared to the other clinics?
Well,
Or-
I really can't 100% answer that. I think it depends on the volume of people they can serve there. And when they have a small school, sometimes it's hard to have a full service, 5-day-a-week kind of clinic. So I think if they can expand and see other students in the building, the probability is that they could be there more, but they haven't told me when and where and that sort of thing.
I guess I'll just share this thought as a member of this committee, and having been interested in this topic and specifically services for this school, even though it's outside of my ward. It's an important service need for the students at this very racially diverse school, and I feel that we need to step up and support them. And if there's anything that this committee can do, I would personally be interested in how I could work with the committee members to move that forward, to provide better service for the students at this school and for the members of the community. Thanks.
I will share that with my contact at the People Center, so thank you. I'm sure that they will reach out, and that would be much appreciated.
Go ahead and
Okay.
continue. Thank you.
Thank you for the question. I'm going to move ahead, and I was talking about the PrEP grant and saying that we're very excited to get these funds because it really helps us do work around pregnancy prevention. And then I think it was a really good opportunity to share with you that the health department recently put together an updated report card of the births of young teens in Minneapolis. And we have one of our authors in the audience, but I was going to share kind of quickly the number of births to teen mothers, as you can see, between ages 15 and 19 have dropped dramatically in the last 12 years, and even before that. So that's very exciting. You can see on the next slide that we've had drops in percentage changes across all of the ethnic and racial groups in Minneapolis. And you can see per year and the over 10-year change and the 5-year change. And so that's really amazing and very exciting to see some of those pregnancy rates drop as they have. But unfortunately, we still have some work to do because we still continue to have health disparities on those young teens that do have births. Even with fewer numbers, we're overrepresented in some of the groups, as you can see in this chart. So the PrEP grant is just one of the many focuses. There's many other things that need to continue to go on to keep those focuses going, and then also targeted more to the groups that are experiencing the higher rates of pregnancy. So that is what I prepared. If there's any questions, I'd be glad to answer them.
Before questions, I just wanted to take a quick moment. In my work prior to being in City Council, I was fortunate enough to do a lot of the youth development focused work in the city and be able to work closely with Barb and Gretchen and all the other work that they're doing. And so I just wanted to give them a quick shout out because they're doing really amazing work and really filling some serious gaps that if the health department wasn't stepping up to address those gaps, that they would be gaps. And so thank you very much for all of the work that all of you have done. With that, are there any questions from my colleagues? All right, thank you very much.
Well, thank you so much.
Seeing no questions, I move approval of this item. All those in favor of the motion, please say aye.
Aye.
All of those opposed say no. The ayes have it, and that item is approved. The next meeting of the Public Health, Environment, Engagement, and Civil Rights Committee will be on February 12th. And tune in then to actually, we're going to be having the Civil Rights Department come and present the city's disparity study that has also been done in partnership with many other public jurisdictions throughout the Twin Cities. So on February 12th, that's when the Civil Rights Department will be coming in and making that presentation. Seeing no further business before this committee, we are adjourned.